What's up everyone, Steve here, your favorite physical therapist. So after a knee replacement, your surgeon probably gave you a list of a whole bunch of exercises to do. Your physical therapist also probably gave you even more exercises to do and other things to focus on. However, if you're like most people, a couple months later, you're going to be sitting around and realizing your core's gotten weaker, your glutes, your legs have gotten weaker, your arms and back have gotten weaker. I'm going to show you how to address some of these new deficits that you might be realizing you're having. So here are 4 exercises to help you regain some of that strength in your whole body after a total knee replacement. Let's get started. Exercise number 1 is a simple glute bridge. I start here with nearly everybody after one of my knee replacement patients. Having strong glutes takes load off the joint, and you can do this exercise without having to bend your knee in deep knee flexion. So for this exercise, lie on your back with your knees bent, keep your feet flat, and push through your heels, not your toes. And lift your hips up, squeezing at the top, holding for 2 to 5 seconds, slowly lowering your body. Do this for 10 to 15 repetitions. You're going to feel this largely in your glutes and your hamstrings and your lower back. All of these muscles have been neglected during your recovery. This one starts waking them back up. A simple way to increase the difficulty of this exercise is to do this on a couch and to put your feet on the armrest. This maximizes the range of motion and can increase the tension. This maximizes the range of motion and allows you to get more out of the exercise. Exercise number 2 are seated resistance band rows. This one is for your upper body and for your posture. After surgery, you've probably been sitting in a chair more, so you're a little bit more hunched forward. And if this goes on for too long, you will get weak shoulders and a weak upper back. Sitting in a chair, you're going to loop a resistance band around a door handle or any sort of stable post in your home. You're going to hold with both arms. Now pull your elbows straight back like you're rowing a boat. Perform this exercise slow and controlled. You're going to perform 10 to 15 repetitions. And if you don't have one of these bands, I will link to one below. They're inexpensive and they're great tools. Exercise number 3 is going to be a standing heel raise, or also called a standing calf raise. Now this one looks pretty simple, but don't underestimate the importance of calf strength and calf mobility in maintaining good balance and helping you recover from your knee replacement. The setup that I like to have people do to perform calf raises is to stand in a door frame. This allows you to actually lean forward a little bit and maximize the range of motion in your ankles and in your calves during this exercise, which makes the exercise more effective. In general, higher rep ranges are needed for calf work. So with this exercise, you're probably going to need somewhere between 10 to 20 repetitions in order to feel a really good burn in your calves. Hey, could you do me a favor and subscribe if you haven't already? I'm doing my best to put out good content to help seniors get stronger, improve their mobility, and maximize their independence. Thanks a lot. Exercise number 4 is going to be a wall push-up. This can be performed in the same position as where you were doing your calf raises. If you were in a door frame or standing in front of any sort of sturdy object like a kitchen counter. So here you're going to place your hands flat on a wall right in front of you, and you're going to do your best to lower your chest directly towards the wall, just like a standing push-up. You are going to let your chest get closer to the wall or to the kitchen counter that your hands are placed on, and then you're going to push back. That's it. Doing 10 to 15 repetitions at a time. This exercise is great for your chest, your shoulders, your back. If you wanted to make this exercise more difficult, you can step back with your feet, or you could find a lower surface to do this on in your house. So that's it, guys. 4 exercises: a glute bridge, a standing row, heel raises or calf raises, and a modified push-up. And in general, these are completely safe for somebody after a total knee replacement. And that's the big shift that it's time to start having if you're a couple months post-op total knee replacement. It's time to stop focusing on just your knee and focusing on getting your whole body stronger, getting your whole body back. So drop a comment below. Tell me where you're at in your total knee replacement journey. I do my best to read every comment. If you have any other questions, I do have a guide to a total knee replacement. It will be in the link down below. I hope you enjoyed this video. I hope it helps you. Have a great day.